Hi, I'm Dr. Don Bonner with Personalized Wellness. Today we're going to be talking about a serious topic in depression. In one of my earlier videos, you can go back to that, and I'll have a link up at the top here. I'm not sure which side it shows up on, but I'll have a link to that video where I talked about functional medicine and how we look at depression and mood disorders and the different things we do. And some of those things, diet and nutrition, obviously are going to have a big impact on depression. There's supplements that we use. Exercise obviously is very beneficial for depression. That's definitely been shown. We use amino acid therapy, high dose amino acid therapy for depression, anxiety, and mood disorders. One of the newer things that we're actually beginning to introduce here in the clinic, which I think is going to really help and be a bit of a game changer, is peptide therapy. I think that's really going to be advantageous for patients with mood disorders or depression. But today's topic is ketamine for depression. We do use ketamine here in the clinic. We use IV ketamine. It's actually a really simple procedure in the sense of how we do it. You come in just like you would for an IV therapy. We do some basic lab work for sure. We check your vital signs to make sure everything looks good. We start an IV, and the ketamine infusion, I usually use somewhere around 0.5 milligrams per kilogram. So it's actually a very low dose of ketamine compared to what I'm used to using as an anesthesiologist. So it actually is a very low dose. We run it in over 40 minutes. Patients do really well. Side effects are very minimal. I do give you some Zofran up front because there can be some nausea involved. Patients typically are dizzy. You can have kind of an out-of-body experience. There's certain things that we walk you through to make sure that you're aware of before you have the infusion. You have to have somebody here with you in the clinic to take you home. We definitely don't want you driving or after having the infusion. But the thing that really is exciting about this particular procedure is how fast it works. Anybody that's ever had any patients with depression issues or friends or family know that when you begin to take the medication that they prescribe for depression, such as SSRIs or Wellbutrin, which works on the dopamine side of the system, they'll all tell you the same thing, and that for the antidepressant effect takes a very long time to kick in, weeks to months before you notice any difference with depression. The really fascinating thing with the ketamine infusions is that it happens very rapidly, and you really will notice this from the patients. They'll be calling you the next day to say, wow, something dramatic has happened. And it really is that dramatic for a lot of patients. We don't know exactly the mechanism of action. There's a lot of research going on right now. I think it's really exciting. We do know that low-dose ketamine helps to increase a neurotransmitter in your brain called glutamate. Glutamate's actually an excitatory neurotransmitter. And the theory is, especially with some of the animal models that are out there, is that the ketamine prompts the brain to form new neural connections. They think that that depression, stress, long-term stress, there's a lot of different ideas or mechanisms out there that basically think that part of what goes on with depression is that in the prefrontal cortex of your brain, you lose certain neural connections. They think that they're dendrites. It gets a little complicated. But what they've noticed is that when you give ketamine, it basically causes these areas of the brain to light up, and you form new neural connections. So I think that's very, very exciting, actually. And that's why it works so rapidly when you get these ketamine infusions. Typically, these neural connections can take place very quickly, within 12 hours or so. So I've had patients say that they had the infusion, they went home, and all of a sudden something lifted, and they felt very different, which would make sense if this is the mechanism of action, these new connections or these connections basically starting to light up again in your brain. So again, I'm really excited about ketamine and its uses for depression. We're trying to work on different things to make the ketamine last a little bit longer. What I do here in the clinic at Personalized Wellness, I'll do one infusion for a patient, and basically we'll see what happens. If we get really good positive results, then we'll continue. And by continuing, we try to get somewhere between 5 and 6 infusions in over about 12 days. That's basically what I do for most patients. Now, if I do a ketamine infusion on somebody and they tell me that they didn't get anything, they didn't feel, much of anything, then I give them a choice. I feel that at that point, there's a pretty high likelihood they're not going to get a benefit from the ketamine. So I give them a choice to whether or not they want to do another ketamine infusion. And if they do, obviously we will. And we'll see if that makes a change. If it doesn't work at all either, then I would advise them not to get any more infusions. After the 5 or 6 infusions, then that's where I'm thinking that maybe peptide therapy with some of these nootropics, cerebrolysin, some of these different types of peptides might be a bridge for taking these patients through a longer period of time without having to have any other ketamine infusions. Again, I think that's something we're going to have to work on and look at in the future. I think the field's exciting right now. I think it's really helping patients, especially patients that have suicidal issues, suicidal ideation. I think ketamine's really a game changer for those particular patients. But again, I'm Dr. Don Bonner with Personalized Wellness. Please hit that subscribe button down at the bottom. That helps us out as a channel here on YouTube. Give us a call. We'll be more than happy to talk to you. The clinic number is 601-898-0911. The only other thing I'd like to say in closing is that the efficacy of these infusions are actually very high. And I've seen anywhere from 65% all the way up to 80 to 90% efficacy for these ketamine infusions. I think that when you combine it with a functional medicine approach, and we're doing the other things such as amino acid therapy, especially diet, nutrition, sleep, I think you put all of those things together, I think the efficacy can be very high. So again, give us a call. We'd be happy to see you. And again, I'm Dr. Don Bonner with Personalized Wellness. Thank you.